On behalf of the government of Nigeria, I commit to protecting progress made in safeguarding the health and rights of women, children, adolescents, and the elderly everywhere through the PMNCH COVID-19 call to action. We reaffirm our commitments to universal health coverage through improved and expanded primary health care and pledge our commitment to action that will arrest and reverse risks to women's, children, and adolescent health and well-being, even during and after our COVID-19 response and recovery. On behalf of the government of Nigeria, we commit to building a model that leaves no one behind, but caters to the needs of everyone through strategic interventions that address the needs of children, adolescents, women, and men. We have launched and repositioned our reproductive, maternal, neonatal, child, adolescent, elderly, health, and nutrition multi-stakeholder partnership coordination platform and developed a continuity response plan for 2020 to 2022 to support and galvanize actions for RMNCH and N services. Nigeria allocates 1% of its consolidated revenue fund to the Basic Healthcare Provision Fund to support the poor and vulnerable in the provision of a basic minimum package of healthcare services through interventions unfolding at primary and secondary healthcare centers. They include reproductive, maternal, newborn, child, and adolescent healthcare across developmental stages of life and prioritize these population groups nationwide. We reaffirm our commitment to support efforts to increase contraceptive prevalence rate and the uptake of family planning services, and hence we have revised and launched a costed national implementation plan for family planning and reallocated $4 million in the 2021 budget to the Federal Ministry of Health UNFPA Basket Fund for procurement of commodities. In addition, we also fully committed to the Nigeria Gavi Transition Plan for immunization for over $2 billion, with Nigeria pledging a $1.97 billion over the same period of time. In partnership with the World Bank, we are implementing a nutrition intervention program named ANRIN in 12 states to the tune of $232 million. We committed to the provision of 800,000 million Nigerian naira for ready-to-use therapeutic food to avert severe acute malnutrition in children under 5. With respect to sexual and reproductive health and gender equality, we developed the following policies, strategies, and guidelines for implementation: a national policy on health and development of adolescents and young people, updated IMNCH strategy to RMNCAEH plus N strategy, a review of Nigeria NSPAN, national guideline for care of newborns, respectful maternity care guideline, accelerated roadmap for maternal health, self-care guidelines, contributory insurance scheme for the elderly, policy of prohibition of female genital mutilation and gender-based violence. We are committed to improving access to potable, clean, safe water, to domestic hygiene with appropriate toilets and hand-washing facilities, in multi-stakeholder partnership with the Ministry of Water Resources, Ministry of Environment, and Ministry of Women Affairs. We are aligned with the following as outlined in the Partnership for Maternal, Newborn, and Child Health Call to Action on COVID-19. ensuring access to information, health services, and life-saving supplies for women, children, and adolescents, promoting sexual and reproductive health and gender equality, improving access to safe water, to sanitary toilets and hand-washing facilities, preventing violence against women, children, and adolescents and the elderly. We look forward to a Nigeria where every pregnancy is desired and safe, and every child survives and grows to a productive adolescent and adult, to build a society where every life counts. My name is Osage Ehanire. I am the Minister of Health, Federal Republic of Nigeria.